Usually, when we think of having a conversation with someone, we think in terms of the words we say, our spoken language. However, many studies find that most of our messages are sent nonverbally. Studies estimate about 70 to 85% of communication is nonverbal, through posture, facial expressions, and nonverbal sounds like sighs or gasps. Every culture has its own set of meanings for different body movements and sounds. What are the cultures you are going to encounter in this deployment? If you don't know what is appropriate, be sure to ask. Pairing door openers with appropriate nonverbal communication helps others to talk about their feelings. Solar is a way to remember body positioning when sitting that conveys attentiveness and concern. Sit squarely, open posture, lean forward, eye contact, and relax. The L-shaped stance can be adapted for use when sitting. The responder should position themselves at an angle when possible. This is particularly useful when there is not a table between you and the person you are communicating with. The following behaviors are generally found to promote increased trust and communication. However, they may need adapting to your own culture or the culture of the person with whom you are working. Face the speaker. This may not be appropriate with some Native American populations. Display an open posture. Keep an appropriate distance. Frequent and soft eye contact. Appear calm and relaxed. Soft tone of voice. Smile. Interested facial expression. Open and welcoming gestures. And allow the person you are talking with to dictate the spatial distance between you. This can vary according to cultural or personal differences. Paraverbal communication refers to the messages that we transmit through the tone, pitch, and pacing of our voices. It is how we say something, not what we say. The paraverbal message accounts for about a third of what is communicated to someone. Tone of voice and the way in which we choose our words is important. When we are angry, we tend to speak more rapidly and at a higher pitch. If we feel someone is attacking us, we tend to respond in short, curt sentences. However, paraverbals can be misread. Regional or culturally influenced accents can confuse our reading of tone. Some people tend to end their sentences on an upward note, others on a downward note, regardless of the mood they are in. Listen to the following example and note how one sentence can take on multiple meanings depending on how it is spoken. I didn't say you were wrong. I didn't say you were wrong. I didn't say you were wrong. How you respond to someone can be much more important than what you say to them. In addition to nonverbals and paraverbals, our goal is to be congruent, having our words match what our body and voice are communicating. We want to use closed-ended questions, yes or no, when we are trying to get someone to focus. Use more open-ended questions when we are trying to get someone to engage in conversation. Your active listening skills will be your primary tool for this. Attend to the speaker and paraphrase or repeat what you hear while nodding or giving other nonverbal cues indicating you hear and understand what they are saying. When people experience an escalation of emotion, they also experience a rise in their energy level. As people become anxious, their energy level begins rising. By the time they are agitated, their energy level may be very high. De-escalation can help bring someone's energy level down or reduce their level of tension to the point that they are able to regain control. When a person is calm again, they may feel like their energy level is lower than normal. Eventually, their emotion and energy will level off. This is true for everyone, not just people affected by disasters. For example, as a helper, your energy level will rise when you are dealing with someone who is anxious or agitated. Following the interaction, you may require some time to regroup before working with another person. Here's an example of a situation that illustrates the elements of escalation. Joe has been waiting to see a specialist to talk about a recurring pain. He's waited for 30 minutes. Joe approaches the reception desk and asks the receptionist, "Did you page the doctor?" And, "Does the doctor normally run this late?" 15 minutes later, Joe approaches the desk and says, "I'm not leaving this desk until I see the doctor." If the receptionist is not skilled in de-escalating Joe, he may continue to verbally escalate. He might loudly complain, "I don't know what kind of place you run here, but I would think any doctor worth his salt would get rid of a bunch of incompetent staff like you. You've done nothing but read magazines since I've been here, and no one is helping me at all." Lastly, if Joe is allowed to escalate, he may threaten the receptionist in some way, or threaten to act out his agitation, such as by saying, "I'm going back there to see the doctor, and you can't stop me." Intervention can be successful at any point in this scenario. However, it is easier to prevent escalation than to intervene after someone has already escalated. For example, the receptionist could have told Joe at check-in, "The doctor is running late. He's had an emergency surgery to perform. You're welcome to wait, but I can't guarantee how soon he will get here." If Joe chooses to wait, his anxiety could be kept in check if the receptionist gave him periodic updates, like, "There's no word from the doctor yet. Are you sure you want to stay? Can I get you a cup of coffee while you wait?" In a disaster service center, this would mean giving frequent feedback to those waiting to apply for services as to why there might be a delay, and what the time frame might be before they will be helped. This is similar to what is done in amusement parks, where there are markers along the line that say, "You are 30 minutes from the ride." You may need to use this tool to help other responders and disaster aid workers understand how their actions impact survivors. Sometimes we can get caught up in our mission and lose sight of the impact we have on others. Behavioral health may be called upon in the field to assist with someone who is becoming agitated. Do not become defensive, and remember to practice your skills to help the person to regain control. This is what is referred to as de-escalation. To effectively de-escalate someone, we must be able to recognize when the behavior is rising or escalating, and what the behavior will look like when it returns to normal. One of the hallmarks of the disillusionment phase of the disaster is the emergence of anger, often directed at volunteers and public officials. Sometimes anxiety can escalate to become anger and agitation. An individual under a great deal of stress can sometimes become irrational and infuriated by what is going on around them. Sometimes people appear to overreact to a situation, but what may be happening instead is that they came into the situation vulnerable to reacting further. Remember the energy curve? If someone has already been anxious and moving toward agitation when you encounter them, then they may escalate more quickly, or more intensely than you would normally predict under similar circumstances. If someone is challenging authority or questioning, answer the question. If you are following the rules and regulations of your organization, explain this, and then offer to find a supervisor for them to talk with regarding their concerns. Remember to use a neutral tone of voice and not to be defensive. You can also repeat your direction or request. This is especially useful if you are attempting to give a direction that the person needs to follow for safety reasons. Repeat the same direction, in the same neutral tone of voice, over and over. For example, "Please lower your voice. Please lower your voice. Please lower your voice." Note, give the direction in a positive way. Tell them what you want them to do, not what you don't want them to do. "Please lower your voice" is much more effective than "stop shouting." This should always be conveyed with kindness, but in a firm manner. Anxious people tend to be fairly verbal. They may demand to see someone, to talk to a supervisor, or to go to the head of the line. Their voices rise, and they might speak more rapidly than usual. The best time to intervene is when someone is showing signs of anxiety, but before it progresses to agitation. You've heard the phrase, an ounce of prevention is worth a pound of cure? In the case of someone who is anxious and becoming angry, preventing the escalation is the ounce of prevention. It does take a pound of cure when the person has escalated and needs you to help them regain control. As people become agitated, they may initially refuse to follow directions. In a disaster situation, this is potentially life-threatening, so it is important to gain control of the situation quickly. However, shouting and demanding that they follow directions will not achieve the goal of gaining immediate compliance. Instead, it will probably throw fuel on the fire and cause the situation to escalate. Help the individual to gain control of him or herself. Instead of thinking in terms of gaining control over the individual, tell yourself that you will help them gain control over themselves. This will lead you to react in a more helpful manner. Remain professional. As the person escalates, you must retain your professionalism. If you become defensive or irrational, you will have very little chance of diffusing the situation. Irrationality breeds irrationality. If the person senses you are losing control, they will also lose control. It is often easier to react in a professional manner if you are not alone. Using the buddy system can be a very easy way to help you retain your professionalism when dealing with a difficult situation. Consider restructuring your request. You may have made a request or given a direction that the person did not understand or finds difficult to comply with. You could make your request in a way that gives the person some control. For example, instead of saying, "Please sit down," you could offer a choice. Would you like to sit down in this chair or that one? The person is offered a choice of seats, and the option to remain standing is taken away. Give the person time to consider your request or direction. Sometimes the person needs time to process your request or direction. This is especially true if they are highly energized and your request was complicated. Consider simplifying the request and allowing the person a few moments to think before responding.